everybody for being here today. It's so wonderful to see all of you, and thank you so much, Dr. Koitkin, for hosting this and inviting me. This has been really wonderful to hear all these wonderful colleagues speak. And so, what is this? There we go. So I have no financial disclosures. So the objectives for this talk is really to give you a sense of the definition of palliative care, differentiating palliative care from hospice, and then also defining what the role of palliative care can be in the treatment of cancers. And so, first of all, the question comes up, what's in a name? Because what I do is often housed under different names depending on the institution. So some institutions call it supportive oncology, some call it palliative care, palliative medicine. Of note, the national board for my specialty is actually called Hospice and Palliative Medicine. I wanted to bring this up because oftentimes when I meet people for the first time in clinic or in the hospital, I differentiate and let them know that hospice is something I am trained to do, but it's not necessarily my focus when I'm speaking with patients and families, okay? So it's a board-certified medical specialty. It's relatively new. It's been a specialty since around 2006 or so. And so it focuses on improving patients' quality of life and managing their pain and other distressing symptoms of a serious illness. So it's provided at the same time as other medical treatments. So just to clarify, it's not the same thing as hospice. Thinking about hospice, it is looking at end-of-life care only, and it's usually considered a subcategory of palliative care. Palliative care, I would say, is the entire spectrum. So it can be something that is part of people's care from the moment they are diagnosed with whatever serious illness that we may be talking about. So thinking about the role, as I mentioned, I look at symptoms, I look at quality of life. So thinking about symptoms, here we're talking about pain, nausea, constipation, difficulty breathing, issues with appetite as well, and just thinking about, your general coping as well. And so what I often bring up to folks is that I'm what I would consider an additional layer of support as you're going through your treatments. Thinking about quality of life, one of the things that I help with is discussing about what makes sense based on people's values and thinking about their lifestyle and thinking about all the different treatments that are available. Today, this afternoon even, you've heard a lot from my colleagues who are surgeons and interventional radiologists and medical oncologists as well earlier today. And so oftentimes it can be very difficult to kind of sift through all the different options and think about the prognosis, thinking about what your life looks like currently. And I and my colleagues can be one resource to help put together all of those pieces. One other piece that I also help with is talking about emergency situations. So thinking about advanced directive, paperwork, and code status as well. Okay? And so thinking about the science behind all of this, people often ask, has palliative medicine actually helped others? And so oftentimes our field will reference back to this landmark study from 2010. This was with patients who have lung cancer. And essentially what this study showed is that early palliative care can lead to significant improvements in both quality of life and mood. And so in this situation, you had a physician who would come in and see the patients on the same days that they would come in and see their medical oncologists. And they would also help by talking about symptoms and talking about their advanced care planning as well. People ask, will palliative medicine help me? So it's helped other people, will it help me? I would argue that my specialty, palliative care, is providing that holistic type of care for folks. And I would say that you and your loved ones are more than your diagnosis. So sometimes having that additional MD like myself there to talk with you can help to flesh out those pieces of what makes you you. Okay? So I wanted to reference back to the fact that oftentimes there's the conversation about how this is a war on cancer. In many ways, this does feel like a battlefield that you and your loved ones are walking through, and it can be very traumatizing. one of the things I bring up is that it can be very helpful to have allies during that battle. You're the person going into these appointments, you're the person going through all these different testing and these procedures, but it's always helpful to have people there to help you and your loved ones through this. So the analogy that I give is oftentimes when you're coming to a large academic center, you're seeing medical oncology, you're seeing surgical oncology. Those are your heavy hitters. I would say that's the US and Great Britain perhaps as your allies. I would say think of palliative care as Canada, I would say. So we don't necessarily have the biggest arsenal, but we're there to help when you need us, okay? So these are my references. Thank you so much again for having me speak with you.